Welcome back to Meds Made Easy. My name is Tarun. Let's talk about Diclofenac today. Very common medication, which you probably see on your store shelves, is Aleve. That's what Diclofenac is. It comes in topicals, it comes in liquids, it comes in tablets, capsules, you name it. I'm not even going to go through the different strengths just because it's so random. How you take it is random. It's generally a longer acting NSAID. It's called an NSAID, a non-steroidal anti-inflammatory. So it kind of rivals, it's like a cousin to ibuprofen and ketoprofen and phenoprofen and that whole sort of family of anti-inflammatories or NSAIDs. And so let's see here. It is a COX inhibitor, and so that's how it kind of does its thing. It's an anti-inflammatory. That's just the best way to put it, guys. Take it with food because it will cause an upset stomach. Also, the longer you take it, the longer you risk of having more GI issues. So always kind of take it with food. Make sure you kind of buffer it out. Man, it's such a wide-acting drug that a lot of issues can happen if you're on it long-term. If you're on it short-term, it's great. I mean, people take Aleve all the time. It's over-the-counter. It's generally a very kind of safe medication. It does have black box warnings though, so let me kind of talk to you about some of the scary stuff of it. Cardiovascular events, causing heart attacks, things like that. Yes, it can cause that, so if you have sort of heart issues, make sure that your doctor knows. Don't ever overtake, because you can buy Aleve on the over the counter. Don't go taking tons of this stuff, all right? It can harm you. If you take it the right way, it works just fine. It's great. And then also it's a black box warning for heavy GI issues, gastric bleeding, essentially your stomach's bleeding, things like that. But again, if you're taking within the reasonable amounts of what the indications are, you're gonna be fine. You shouldn't be worried about it. Now, if you have had like GI issues in the past, like severe issues with GERD, gastroenteric reflux disease and things like that, then yeah, you wanna make sure you consult your doctor about it. Pregnancy, you cannot take this usually during pregnancy. There are very few doctors who even let you, which actually you have to question the ones that do, because it's a pregnancy class C and D, so it's not really medications you want to take. It has been known to cause birth defects, especially the longer you go throughout your pregnancy. So it might be safe. Don't quote me on this, I think it's safer in the beginning, but towards the second and third trimester, it is a pregnancy class D, which is like you don't want to take this. It is present in breast milk, so you have to have your doctor constantly test you if you need to be on this medication. Also, long-term use of this drug will cause renal issues. It'll damage your kidneys. It's just how it works. Again, it's very broad-acting, so it hits a lot of different things. I mean, think about it. You could take it for a headache. You could take it for muscle pain. You could take it for arthritis. Any sort of issue where you have inflammation in the body or something, you can take this and it'll work. So, you know, you hit your head, it'll work. If you stub your toe, it'll work. If you're in a car accident, it'll work. So you have to kind of question medications like that. If they affect a bunch of different things, then you have to also know that the side effect profile is going to be big because the therapeutic window is big. If you can treat a lot, then it can also damage a lot too. Again, taken in normal amounts, it's totally fine. You just have to watch out for your stomach. Don't take it regularly every day like Skittles or something like that. Treat it with some respect. Take it in moderation, and the medication is actually safe, and it's actually very, very helpful. Let me try to see if I've covered everything. I did say take it with food. I'll put up a list of side effects here. You know, you're going to see a lot of issues, things like edema, which is like fluid in your feet building up, things like that. If, GI and hypertension as well, people that are hypertensive, have high blood pressure, you shouldn't be on this because you'll see things like what I just mentioned, the edema, fluid backing up into your feet and things like that. So the more issues you have, if you're a diabetic, et cetera, et cetera, et cetera, you kind of have to watch out with these medications because you can see some unwanted side effects, and we don't want that. If you're a perfectly healthy human being, then you can kind of generally take it more casually and not worry about it as much and not have to consult a doctor. But if you do have all of the issues, like I think the only thing you can have that it won't affect is, no, actually it does. Cholesterol, hypertension, diabetes are really the main big ones. You should kind of run this past your doctor if you're taking this frequently. If you take it as a one-off, I have a headache, you took one, you're totally fine. You're going to be fine. Even for our hypertensive patients, we tell them it's fine to take it as long as you monitor your blood pressure. If your blood pressure spikes close to 200 after taking one dose of 200 milligrams, yeah, probably let's not do that. But a lot of patients who are able to take it, their blood pressure maybe shoots up just 10 millimeters of mercury. So, if their blood pressure is 140, they're at 150, it's not great, but you can take it temporarily if you need relief for a headache or something like that. But if you're going to be taking it for a couple of days, let's try to find you something better. I think that's it, guys. So leave any comments, concerns down below, any questions you might have. Let us know how we're doing, good, bad, hopefully good. Give us a subscribe, let us know how we're doing. We really want to grow this thing even bigger and better and get better funded. We're just trying to help people, and we want people to understand their medications and not be scared of them. So guys, that's it. We'll see you next time on Meds Made Easy. Bye.